Bovine brucellosis is found worldwide, however the majority of EU countries are free, and New Zealand and Australia are also free. The main pathogens are Brucella abortus, Brucella melanotis, and Brucella suis. Brucella suis is localized in the udder. Brucella is a gram-negative coccoid rod. It's an obligate aerobe and it's capnophilic. It's also fastidious, which means it only grows on certain mediums, and it has type R and S colonies. It is a chronic disease and only occurs in sexually mature animals. It is shed in vaginal discharge, fetal fluids, and abortion. It is also shed in semen. Since it's an obligate pathogen, it will cause abortion in first-time heifers, especially after the 5th month of pregnancy. They will also get retained fetal membrane, but the disease is self-limiting. The disease can enter the body orally or through vernal transmission. It will then go to the regional lymph node and then it'll enter the bloodstream after 2 to 3 weeks, and it'll go into the macrophages. It's a facultative intracellular pathogen, and then it'll replicate and it'll go to the predilation site. In females, this is the pregnant uterus and the fetus and the fetal membranes. It'll cause necrosis of the chorionic villi. This disrupts blood to the fetus, and they'll have abortion after the 5th month of pregnancy and retained fetal membrane. The bacteria is shed from the uterus 2 to 3 weeks after an abortion, but then it's eliminated. However, bacteria can reside in the milk and the joints. In females, there'll be an abortion storm in a naive herd, and they'll also have retained fetal membrane. It'll be brown smelly, as well as having vaginal discharge. There is transient infertility, which means they won't abort future pregnancies. In the fetus, we can see edema and hemorrhages and autolysis and necrotic foci in the liver. And there'll also be a yellow paste on the umbilical cord. It looks like peanut butter. In the males, it occurs when they're sexually mature. They'll have enlarged, warm, painful testicles, and they'll have decreased fertility and decreased libido, and they'll also have an abnormal gait. For the diagnosis, so many methods are needed, such as smear, isolation, PCR, side agglutination test, tube agglutination test, CTF ELISA, and abortion bang ring test. The abortion bang ring test tests for antibodies in the milk against Brucella abortus. And for side agglutination, we need to do the Rose-Bengal test. There is no treatment, only eradication. For prevention, you can give the S19 attenuated vaccine or the 4520 inactivated vaccine. We can also do artificial insemination. This is because bulls can asymptomatically carry the bacteria. And because of this reason, you can't give the attenuated vaccine to bulls or pregnant cattle, as it will cause abortion. So the vaccine is only for non-pregnant females and only in endemic countries. Brucella melanotis can also affect cattle, but it mostly affects sheep. It is endemic in the Middle East, Africa, India, and it's also in the Mediterranean regions in Europe. Just like Brucella abortus, it's a gram-negative coccoid rod, but it has a weak LPS. It is a zoonotic disease and it can cause abortion in the last trimester within sheep. And it can be shed within the fetal fluids, fetal membranes, vaginal discharge, but also in the semen of rams. However, rams are mostly asymptomatic. Just like Brucella abortus, it can enter the body orally or verinally. It goes to the regional lymph node and then it travels up the bloodstream, and then it goes to the macrophages as it's facultative intracellular, and it spreads to the predilation sites. This includes the fetus and the udder, and it will cause an abortion storm in a naive herd. In males, it goes to the testicles and the epididymis, and it can chronically reside in the joints. In ewes, we'll see abortion, retained fetal membrane, and in the fetus, there'll be mummification and autolysis. In rams, this only happens sometimes. They'll have painfully large testicles, and it'll often be unilateral. For prevention, you can give the Rev1 strain, which is an attenuated vaccine, and you only give it to females, just like Brucella abortus. And to detect the bacteria, you can do PCR, isolation, smear, and you can also indirectly detect it using side agglutination, tube agglutination, and the intradermal Brucellin test. You would apply it to the lower eyelid, and if it's greater than 2 millimeters after 48 hours, it's positive. And for canine brucellosis, it's worldwide, it's sporadic. The etiology is Brucella canis. However, dogs can also get Brucella abortus, melanotis, and Brucella suis. However, these are often asymptomatic. It is shed by males in the urine and semen for 2 years, and in females in the fetal fluids for 6 weeks after they have an abortion. Dogs can have chronic carriage for 2.5 years, and it's also a zoonotic and notifiable disease. In males, we'll see scrotal licking, enlarged testicles, and decreased fertility. And in females, we'll see abortion and decreased litter size. The puppies will also be mummified and have autolysis and necrotic foci in the liver. For treatment, you can castrate the males, however, they need long antibiotic therapy, so sometimes it's better to exterminate them. And there is no vaccine. And for the diagnosis, you can do PCR, smear, isolation, side agglutination, tube agglutination, CFT, and many of these diagnostic methods. Just remember that brucellosis in dogs is the only one without a vaccine. In cattle and sheep, they do have a vaccine. And Brucella ovis is different to all the other Brucella so far. It occurs worldwide in all the sheep rearing areas of the world. Just like the other Brucellas, it's a gram-negative coccoid rod. However, it's Koster negative. This is different to Brucella melanotinus, which is Koster positive. And it's also not zoonotic and not notifiable, unlike all the other Brucella diseases. It occurs mainly in male sheep. They get infected with the bacteria through an ascending infection verinally, and it'll then go to the testicles, the epididymis, and the kidney. They'll get enlarged, warm, painful testicles and an abnormal gait. There can also be abscesses and necrotic foci in the testicles. For diagnosis, we can palpate the testicles and use a PCR of the shed urine or semen. And also, we can then use side agglutination and as well as ELISA. And for the treatment, castrate the rams as it only resides in the genital tract. It is not notifiable in sheep and it rarely ever causes abortion in females. And lastly, swine brucellosis is worldwide. It's not in Australia or New Zealand. Just like the other Brucella, it's a gram-negative coccoid rod and it's a facultative intracellular pathogen. And just like Brucella abortus and Brucella ovis, and unlike Brucella melanotinus, it's Koester negative. There are 5 biotypes. 1, 2, and 3 are worldwide. 2 is also found in hares, 4 is found in reindeer in Arctic regions, and 5 is found in rodents in the USSR. The bacteria can enter the body orally, and there's also venereal transmission, and then it goes to the regional lymph nodes, and then it'll spread in the blood to the predilection sites. In females, there will be an abortion in a naive herd. It can cause abortion at any time during pregnancy. They will also get retained fetal membrane and brown smelly discharge. And their litter sizes will be decreased. In males, it only occurs in sexually mature animals. They'll have enlarged, warm, painful testicles and decreased fertility. In chronic cases, they can have arteritis, and in very chronic cases, they'll have vertebral abscesses, which will lead to hind limb paralysis. For detection, look at the clinical signs, use PCR. We can also do side agglutination and tube agglutination. There is no treatment, only prevention. Have herd eradication and use AI for boars.